Helios Skin, Hair and Laser YouTube. In today's episode, we're going to be talking about something very interesting, and I think this is apt for the season because we're all getting ready for the weddings. And this episode is especially for those who are preparing for their big day. So let's welcome Dr. Madhumitha, who's going to be taking us through valid tips for the to-be brides and to-be grooms. Hello doctor, how are you doing, Dr. Madhumitha?
I'm fine, ma'am. How are you doing?
I'm doing good, thank you so much, and I'm so thankful to you for being here with us, because this discussion that we're going to be having is going to be really helpful for all those to-be brides and grooms, just like I mentioned in the introduction. So doctor, to begin with, wedding season or getting ready for the wedding itself is a tension for a lot of people.
Yes.
So how does one prepare for that big day in terms of their skincare? Let's begin with the skincare.
Yeah, ma'am. To start with, the skincare depends on your expectations as well as your natural skin health and the condition which you have now. Suppose if you have acne and if it is severe, then the time required for the treatment of acne would be a minimum of 6 months. So if you're getting married in a span of 2 weeks and you come to us, it will be very difficult for us to cure acne in a span of 2 weeks. So if you have certain conditions like acne or severe pigmentation or the leftover marks by acne, then I would say you have to start your skincare prior to your wedding at least 6 months. And if you're just concerned about maintenance of your natural skin and you want something natural glow, then I would say a minimum of 1 month is required. So you have to start with a good use of sunscreen, which is compulsory, and also you can start with some anti-pigmentation agents. So for that you have to consult a dermatologist. So all these can be combined with certain procedures where there won't be any downtime, there is no redness or no obvious peeling of your skin. So you can do certain procedures which can make your skin glow and also improve the pigmentation. Whereas if it's like severe acne, then you have to consult a dermatologist prior, and a protocol will be designed for your skin type and according to how you respond to those.
So doctor, you've been mentioning about treatments and how to prepare one's skin. So I'm sure this is more for the bride, and I'm very certain that grooms are equally conscious about the way they look. So do the treatments differ for the bride and for the groom?
So basically, the skin type for men and women, it's little bit different, whereas the skin of males, no, it's little bit thicker when compared to females. And moreover, the procedures which we do for men and female differ in little bit way. I would say one major thing for grooming for men is beard reshaping. So see, when they keep shaving or trimming, they tend to develop ingrown hairs, which will lead to some pseudo-folliculitis like lesions, pimple-like lesions, and that will lead to a scar. So and most of the times they shave according to a particular shape, and they are not able to sustain the shape for a long period, and because of that they are shaving it very frequently. I would say laser hair reduction is not only for brides or generally for females, it's also for males. They can get laser hair reduction. It's a permanent procedure where they can get proper beard reshaping. They can also even trim the hair on the neck and also even the forehead, and most of them they also ask for laser hair reduction on their ear, that is the outer surface of the ear, the pinna which we call. And some people will have excess hair there which is not cosmetically appealing, so they can also get procedures done for that. And most of the times men think that sunscreen is something which is not for them, skincare is something which is not for them. So that's not the truth. Skincare is for everyone. So I would suggest everyone to meet a dermatologist to get a protocol designed for their skin type, and suppose if they have any particular issues, they can get it addressed. And sunscreen is a must for everyone, and it's said that sunscreen can be used by everyone starting from a 6 months old baby.
Oh, I see. That's interesting information, doctor. Who does not like to look into the mirror and feel good? No, it doesn't matter if you're a man or a woman, and especially if you're approaching a wedding. I'm sure both the bride and bridegroom want to look their, very best on their big day. So, what kind of, procedures do you recommend or do you have for the bride and groom, to be bride and groom?
So there are various procedures. So we can plan the procedures depending on the timeline. Suppose if they come to us in a span of 1 week before their wedding, then I would suggest to get a basic medifacial done. So here at Helios we have a fire and ice medifacial, which contains a little bit of retinol. So that's a resurfacing one, and it has no downtime. See, when this time is just 1 week, we have to give a procedure where the client should be comfortable. The client or the patient should feel comfortable. There should not be any redness or any obvious peeling of the skin. So I would suggest a basic medifacial. So it can either be fire and ice facial or pumpkin peel facial, or they can even go for carbon peel laser toning along with photofacial. So this will give some improvement in skin tone immediately, even with one session, and there will be a temporary glow which they can sustain it for a span of 10 days. Suppose if they come to us some 3 months prior or 6 months prior, then they can go for many procedures like Q-switch laser toning and micro needling to improve the texture, and also if they are more concerned about the body odor or body sweating something, then they can do procedures for that separately. And for females, especially, some of the patients come to us 1 year prior or 6 months prior, and they even opt for full body laser hair removal, which is very safe.
Okay, doctor, you were mentioning about facials. Now, very interesting facials. You mentioned fire and ice and pumpkin facial. Now, we have facials available even in salons. So, how different are those facials from the facials that Helios offers?
So, as a doctor, I would say that always chemical exfoliation is always safer than physical exfoliation. So in parlors, they do physical exfoliation using scrubbing method that will tend to create micro injuries on your skin. So you might feel a better look after 2 days after the procedure, but eventually it will lead to pigmentation, or you might react to certain products. So here, as a doctor, I always choose the type of medication according to the type of the patient's skin. Whereas in parlors, if there is some facial, they'll do it commonly for everyone. Here it's not like that. Each and every individual will get a design protocol according to their skin type. And here the products which we use are FDA approved. So facials, there are a variety of facials, and we choose according to the skin type, according to the patient's concern, and according to the time they come to us before their event.
Okay, so basically you have a very medical and a scientific approach to the kind of procedures that you give based on an expert's recommendation. Well, doctor, you have these, unfortunately or fortunately, I don't know, how to put it. It doesn't matter, what skin tone you are. Everybody is beautiful, but there is this rush, in wanting to look brighter or whiter. Yeah. So, people go in for the option of skin lightening or skin whitening facials. Now, is there a difference between skin lightening and whitening, and how different is that treatment or procedure from a dermatologist's point of view?
So the procedures which are done in parlors for skin whitening or lightening is something, a basic bleaching. So those products are actually harsh products which will give you a temporary bleach, whereas after that, when you get exposed to sunlight, there will be excess tanning. And those bleaching agents, if they are still persistent on your skin, that can react to sunlight and can lead to reaction also on your skin. So when it comes to medical term of skin lightening or skin whitening, basically that is reduction of melanin. So that starts with regular usage of sunscreen, where you have to prevent the further tanning of your skin and to prevent the sun damage. There is photo damage, which is the medical term which we use. And you would like to start with basic creams which might inhibit the melanin. So that will be added in the night routine of patients. Whereas there are certain lasers which target the melanin specifically. Example, we can say Q-switch laser. It's a very safe FDA approved laser for melanin reduction in every skin tone. But then it's not instant skin brightening. You can't get some 10 shades lighter in such procedures. There are also some tablets, it's oral medications which are available, glutathione tablets, and also some IV medications like glutathione injections or antioxidant IV drips. But then again many people think that many celebrities have become more fair with glutathione. That's actually true, but then I would like to add one point. Glutathione doesn't work for everyone. So basically glutathione doesn't destroy your melanin completely. It's a temporary thing. So basically in our body we have something called eumelanin, which is responsible for the blackish or brownish pigment. And there is something called pheomelanin, which is responsible for a orangish pigment which gives a glow to our body. So normally in our body, when the melanin process cycling is done, we'll have 95% of eumelanin and 5% of pheomelanin. This reason is because only eumelanin has the tendency to protect us from the UV rays. So we are genetically designed like that. So what does this glutathione do? So this glutathione converts the percentage, that is maybe this eumelanin might be some 50% and makes a pheomelanin formation to 50%, and that is the reason you get that glow after glutathione injection. And why and you may ask me why this doesn't work for some people, why this works wonders for some people. That depends on your body's ability to convert to that percentage of pheomelanin. For that, certain enzymes are required in your body to process that glutathione. So that depends for each and every individual.
Okay, that's very interesting. So doctor, you were talking about melanin, and you were talking about the different types of or shades of melanin. You mentioned orangish, So you have, it reminded me of the makeup product, the concealer. Concealer comes in those shades, interestingly. And wedding, no makeup is something that is catching up, but definitely there's a lot of makeup being used. And for some reason, they add in a lot of products, during the wedding. So how, safe is using all those products on the face? Can you talk about that and how to take care of it afterwards?
So makeup products are relatively safer. It's not that it's going to harm your skin, but the way you use it is very important. I would suggest the bride or groom to have a trial session prior to their wedding to see if the particular makeup is suiting their skin or not. And one thing is, most of the times the bride or the groom gets a cakey look because of the excess makeup. That is mainly because of the open pores and the natural oil secretion which is too excess in them. So to avoid that during their wedding, they can go for procedures like meso botox if the time gap is like just 15 days or 20 days before their wedding, or if they have much time, say some 3-4 months, then they can go for procedures like microneedling or resurfacing lasers. So that will cause reduction in the open pores, and during the wedding they will not have that cakey look, one thing. And some brides come to us, like some after the wedding, they come to us with acne flare up or with some reaction or blocked pores and some shiny structures which we call as milia, that is because of sweat gland obstruction. So that is mainly because of not cleansing properly after the makeup. So you have to follow something called double cleansing after your wedding, that's the day after your wedding. So use something called micellar water. Use a cotton pad and keep micellar water in it and wipe it. Do it twice and then cleanse your face with a foaming face wash and then use the micellar water again. Because the makeup products, most of the makeup products which they use are sweat proof and waterproof. So that is not going to go in one wash with your face wash. So I suggest this micellar water and foaming face wash, especially on the day of the wedding. And you talk to your makeup artist and ensure that the products which they use suit your skin, and especially the makeup brushes which they use are either new or they are properly sterilized. And it's suggested to use the sunscreen as the base before the makeup, because as like UV light, even the stage light are known to aggravate acne and also cause any reaction. So I would suggest them to use the sunscreen as the base before starting a makeup.
Doctor, you mentioned about sweat glands. We have a very hot weather, and if somebody has the wedding during the summer, they tend to sweat. Especially, it can be embarrassing for a bride when you have their, underarm pits, or the stain on the blouse. So, is there something that they can do about it? Do you have any procedures that can help them there?
Yeah. So it's a very safe procedure, which is Botox injections for underarms. So it's like a temporary one, but a single session of Botox injections can last up to a period of 6 to 8 months. So initially for the first 3 months there will be complete reduction of sweat. After that, every month it crosses till the 8th month, there will be 10% of sweat production. And you can get it done once a year, something like that. And apart from that, the body odor which accompanies the sweat is mainly because of the bacterial proliferation which is happening there. So for that you have to maintain a proper hygiene. If there is excessive hair over the underarm region, you have to get it removed. I would suggest a safe procedure which is laser hair reduction, and it's a permanent one. You can get rid of it in a span of 6 to 8 sessions, and then the maintenance sessions would be required maybe once a year or something like that. And if there is excessive odor, then you can use soaps with benzoyl peroxide or triclosan. And if you're using antiperspirants, now make sure you use something with salicylic acid, lactic acid or malic acid, something like that, for a long-term purpose. And I would suggest there are some antiperspirants with metal contents, which I don't think you can use it for a long-term period, because it acts by the deposits of the metal products in the sweat gland or the sweat duct. So in that condition, you can use antiperspirants with salicylic acid, lactic acid or malic acid. And if you want that hassle-free underarms, and if you want that perfect sleeveless, and you don't want your blouse to be stained with sweat, then you can go for Botox injections.
Nice. Doctor, you mentioned laser hair reduction, and bikini area is something that people opt for these days. So they have bikini wax that people take. So how safe is bikini wax, or is there laser hair reduction even for those areas? Can you tell us about that?
So in parlors there's something called bikini wax, which is the Brazilian wax, where they apply and peel off, not with a strip but directly it's the peel off one. So the problem with that is they tend to get pigmentation because of the wax product per se, and they can also develop ingrown hairs. So that will lead to pigmentation and also to pimple-like lesions on the bikini area. So that will lead to intense itching actually. And if you want a permanent procedure, then the safest procedure, which is also FDA approved, is laser hair reduction. You might require 6 to 8 sessions initially, maybe once a month, and after that a maintenance session maybe once a year. So this laser hair reduction is very safe. You can even get it done for your private areas like on the front part and also on the gluteal cleft on the back side. So with this, the main advantage is that there is no risk of burns, there is no risk of ingrown hairs, and we see when we do procedures to patients, we also see that the pigmentation also improves when we do laser hair reduction.
So doctor, we were talking about how a bride and a groom can prepare themselves before their big day. So what kind of requests do brides and grooms come, and what kind of treatments do they opt for?
So they mostly come for procedures for detanning. and some of them come for procedures for clearance of their acne scars or something. So we have Q-switch laser, which targets the melanin. So that's it's like you can get many procedures done with that laser, like detanning for the full face, and also even for your hands and feet, and also for the underarms, as well as for even it's very safe even to get it done for your private regions. That's most of them have pigmentation over their inner thighs and underarms. The Q-switch laser is very safe even in that region. And most of the time, brides and grooms ask us for lip toning. They are very concerned about the pigmentation over the lips. I really don't know why they are concerned only before their wedding. So I would suggest them to come a little early. So this Q-switch laser is very safe for them, and they have to use the lip balm with SPF content, so it can give protection against UV rays also. And there are certain medifacials which will give instant glow that will last for some 10 to 15 days, that they can get it done before their wedding. And they also ask for like maintenance of their hair thickness. So for that they have to start certain medications and they have to keep continuing it. And in case of dark circles, it's one of the conditions that's very difficult to treat. So sometimes it's very difficult to conceal it completely even with a very good concealer. So in that case it's better to start the treatment prior in case of dark circles. We can do procedures like microneedling and also Q-switch laser, and they have to start retinol products early. And they can also get laser hair production done. When it comes to females, they can get it done for their whole body, or if not, if they're more concerned about their face, they can get it done for your face. And for males, they can get beard reshaping. And some people ask for laser hair reduction. It's men, they ask for laser hair reduction over their chest because they have that habit of wearing shirts with deep cut, and they don't wear the buttons in the first two layers, and they want that clear V cut. Especially models, they come and ask for us for laser hair reduction over the chest. And for body odor, as I said earlier, they can go for Botox injections apart from their regular maintenance of hygiene.
So thank you so much, Doctor, for sharing with us what all one can do, in preparation for their great day. I hope all the to-be brides and grooms are listening and are watching, and Dr. Madhumitha here has shared some interesting insights into how you can prepare yourself for your big day. Keep your questions coming for us. We will come back to you with more episodes on a lot more issues and treatments that Helios has to offer for everybody out there. This is Sunithra signing off. Thank you very much for watching.